Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to yet another episode of All Things Policy, where we discuss policy issues of relevance. I am Priyal de Almeida and I work as a research analyst at the Takshashila Institution. Now, Takshashila Institution, as you know, is an independent, non-partisan think tank and a school of public policy, and we have education programs that last between 1 semester to 1 year, which are specifically made for people who are interested in getting basic introduction / view of what public policy is. And these courses are all online and you can take them from anywhere. And currently the admissions are open for the September 2022 cohort. And if you're interested in any of the courses, you can always log into school.takshashila.org.in and you will get all the details. The application deadline for the September 2022 cohort is on 27th August. So if you're interested, please log into the website and you can always apply. So today we are going to be talking about how the TB burden has increased since the COVID-19 pandemic began, and how this sort of there is an ignorance in the treatment of TB during this entire pandemic. And to discuss this with me, I have my colleague, Dr. Harshit Kukreja. Welcome, Harshit. Welcome to the podcast.
Hi, Priyal. Thank you so much for having me. How are you?
Great. Good to hear. So today we are going to be talking about how, during the entire COVID pandemic time, the beginning of the first wave, how a lot of TB patients were ignored, or sort of they were given COVID care instead of, giving them TB care in itself. So Harshit, can you let us know why exactly this confusion was there, and why was it that despite some people having TB, they ended up getting COVID care instead of actually focusing on the TB care?
So, this is something I have been advocating for quite a few months now. So, I like to begin this my argument with a story.
Okay.
So, what happens is a typical TB patient, a frail man in his 40s or 50s, a daily wage laborer, basically from the poorer section of our society, comes to an OPD of a government hospital, and this is when the COVID cases are rising. So when he comes in and he says that he has cough and he has low grade fever from quite some time, the healthcare worker, the doctor, or the nursing staff sitting at the counter don't want a COVID patient in a closed OPD to infect everybody else. So they send him to a flu clinic. Flu clinics were
Right.
basically sort of like COVID screening clinics where they screen out for COVID and see if the person, and they do RAT or they do an RT-PCR.
Yeah.
So when he's sent to the flu clinic, when he reaches the flu clinic, he comes to know that the sample collection for that day has closed, and he must return tomorrow. So he has already missed a day of his daily wages. He eats what he earns for that day.
Right.
So he has already missed that. So he cannot afford to miss another day and come tomorrow.
Right.
So because of that unfortunate overlap between the symptoms of tuberculosis and COVID-19, a lot of TB cases were ignored because first for the need of screening for COVID, and second for the misdiagnosis as sort of like COVID negative TB
Right.
or
Positive.
TB patients with COVID.
Right.
So basically, the duration of the symptoms is like quite different. TB is a chronic disease, and COVID is a very acute disease. COVID,
Right.
the fever you will see would be like in days. TB, it would be somewhere in weeks.
Right.
So those are sort of the TLDR, the main reasons of why TB patients were ignored.
Right. So actually, Harshit, over the past decade or so, India has focused extensively on TB care, right? Like we know there are multiple TB programs that are available. I personally, every time I would switch on DD1 when I was growing up, I would see a lot of advertisements focused on, making sure that people signed in for the DOTS program for TB, so that there was a lot of awareness / care for TB that was being there in the country for over the last 10 to 15 years now. So now, given by the example that you said and all, we see that TB care has slightly been neglected in the past 2 years, given the fact that there is some overlap of symptoms and everything. So in that case, like, how has COVID-19, reversed whatever, has COVID-19 sort of pushed us back in the TB area, TB recovery or TB treatment area, or has it completely reversed what we had sort of gained in the past 1 decade?
No, so it has not completely reversed. We have had certain setbacks because, first of all, of non-diagnosing, because we were not able to diagnose a lot of TB cases.
Right,
Second of all, because of the lockdown time, a lot of people were not able to access healthcare facilities. This included TB clinics and dot centers.
right,
Third, because of the economic downturn that COVID lockdown brought, and
right,
still people have not sort of like gotten out of that economic loss they had suffered. So
right.
the TB care has sort of like deteriorated,
Hmm.
and because a lot of TB infrastructure was repositioned as COVID care for battling COVID. So you cannot say that it has been completely reversed. There has been setbacks, and
Right.
we have certainly sort of like lost a lot of progress we made.
Right, definitely. Because, I mean, given the fact that you've told that, there was a lot of, I think, because of overlap of symptoms, unintentionally or intentionally, the ignorance in the taking care of the TB patients, and obviously with the lockdown and everything else, we do definitely, I mean, it's, I think, quite evident that sort of some of the TB development that we've made in the past decade has kind of slowed down, right? Now, actually, Harshit, I have few more questions. Now, before we go there, let's take a short break and let's be right back to continue discussing this. Hello and welcome to this episode of ATP, where we were discussing about how the TB has been sort of ignored ever since the COVID-19 pandemic began. And Harshit, now going back to what we were talking about, right? Before the break, we did speak about why exactly there was a confusion between treatment of like TB and COVID, and why, despite people having TB, were made to go to the COVID-19 facility. And what are the sort of, how we have sort of over the past decade or so, the little developments that we had done in the COVID treatment of and stuff, how it has sort of paused or it has taken a slight setback. Now, moving on, Harshit, can you tell us about like why TB continues to be like, a huge economic burden in India?
So yeah, so TB continues to be one of the biggest killers in India.
Right.
So somewhere around 15, 17 lakh people die of TB every year around the globe. Across them,
Hmm.
around 30 to 35% of the total deaths are in India. So one third of the total TB deaths are in India,
Oh,
and
okay.
TB is responsible for a lot of morbidity also. So TB also affects a lot of other diseases. TB also affects, if you have TB, the chances of you getting AIDS or the chances of you getting COVID increases, and so does a lot of other diseases. So TB in itself is also dangerous, and it also helps the other diseases
Right.
like infect and kill more. So TB is a huge burden, and the government had
Right.
set a target of 2025, that is 3 years from now, for TB elimination. I don't know how successful it would be, but they said they'll try, and this is 5 years ahead of UN's target
Right.
of 2030. So we have a huge burden. We account for more than one third of the total TB deaths, and we want to eliminate this in 3 to 4 years. Obviously, the COVID pandemic has sort of dented our progress, but hope for the best.
Right, definitely. I mean, hope is the one that keeps us alive anyway. So, apart from this philosophical musing, but now how we know for a fact that, TB is sort of like, a major health burden in India and continues to be. And now, as like, policy analysts slash people who know how to, kickstart certain things, what are your thoughts on how can we sort of bring back the focus on TB at this point on, and how do we bring that, whatever we've done so far, and how do we bring back on track the TB elimination programs and stuff?
So you have to understand that TB is a disease of poverty. it does not affect the upper segment of the society. And it used to do that around 20, 30 years ago. Then there was a lot of focus on tuberculosis. And because now that focus has shifted to lifestyle diseases such as diabetes and hypertension and everything else, which are sort of the developed country diseases which we are getting. So we have to bring that focus and we have to look at TB as a holistic approach
Okay.
because TB is related with poor nutrition. It is related with crowded spaces.
Right.
It is related with poor immunity. So we also have to take these things into consideration and
Right.
try to eliminate these things along with eliminating TB. So, for instance, now we have seen that COVID comes and goes in waves. The cases rises because of some new variant.
Yeah.
Then it
Subside.
goes
Yeah, it
down,
goes
then it
down.
goes
Yeah.
up.
Yeah.
Subsides. Yeah, so we also have now this is the third year of the pandemic, of the COVID pandemic.
Yeah.
We have to take care that TB patients are not ignored during the pandemic.
Right.
We have to take care that we segregate TB patients from COVID patients
Right.
so that TB patients are already susceptible to COVID, and we don't want to keep them in same complexes, same OPDs, and same physical health facilities.
Yeah.
We
Right.
also want that we should administer TB. So TB medications are usually given for 1 month because we want to check compliance and we want the patient to come back for his checkup.
Right.
For instance, if there is 6 month TB medicine year, the program, the 6 months regime for the patient. So the patient is expected to come for like every month
Right.
so that he gets checked. You check his compliance, if he is eating his medicines or not. So we have to increase this period to somewhere around 3 months. And I think when the cases rise, we should shift to sort of like e-visits or video visits and or maybe like phone calls
Right.
so that whatever we did in COVID patients, we can do those in like TB patients.
Yeah.
And we should take care that we don't sort of like repurpose our TB facilities whenever the COVID cases rise.
Yeah.
So these are
Basically,
sort of like
yeah,
I would
basically
suggest.
like sort of give equal importance to TB as well. Don't sideline TB just because like, there has been a massive COVID wave, because we need to understand that TB patients are extremely susceptible to COVID, and, having them kept separate is best for, the TB patients in the long run, right?
Yeah,
Yeah.
that is a important factor.
Yeah. And I think because like since TB is already a huge burden and we know it, right? We know what needs to be done. There's so much of like research slash, methods that have been applied into like, trying to decrease this economic burden. Also, like you said, how TB is just like you can't just focus on the disease. You need to understand multiple other factors that are involved. I think one of the things that you might have missed was also, I think, sanitation, which is a given. Consider the fact that you told about the living in a crowded space and all of that combined. So sanitation also plays a very important role, I'm assuming.
Yeah, obviously sanitation and respiratory hygiene is a
Right.
important factor when you look at these diseases. That is quite an important consideration.
So yeah, thank you so much, Harshit. Thank you for joining me today in, talking about one of the important things that I think a lot of people have sort of have something that has been ignored in the past 2-3 years because of the pandemic. TB needed that, some importance in this entire thing, and I'm glad that we could speak about it. So thank you for joining me for this podcast.
Thank you so much, Priyal. Thank you for having me.
Yeah, definitely. It's always a pleasure having you. Thank you. And to our audiences, I hope you had fun listening to this podcast, and please continue listening to all our other All Things Policy podcasts as well. Thank you.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.